leaky veins and ED? Let's talk about it more. See you on the inside. Venous leakage is a condition that contributes to ED. Normally, when you have an erection, imagine like a balloon. You blow air in the balloon. So when you blow the air, that's like blood flow. That blood flow that comes from the heart that goes down to the penis. When air comes into the balloon and your penis is a balloon, when you blow air, the balloon inflates. It's the same thing. With blood flow to the penis inflates, and then the balloon expands. The penis muscle expand, allowing for the air to come into the balloon the same way the penis, allowing blood flow to come into the penis, and it gets enlarged. And then when it gets enlarged, what happens is that as the penis muscle swells up, it on the outside of the corpus cavernosum, or the penis muscle, there is a fascia wrapping around it, and that fascia compresses against the muscle, and therefore the veins are in the middle between the muscle and the fascia. And here's the vein. It's like a little simple blood vessel, and the vein gets compressed against the fascia, called the Buck's fascia. It gets compressed between the fascia and the muscle, and when the veins get compressed, the blood stays in the penis and it doesn't leak out outside of the penis. In order for you to get an erection, the arteries are blood vessels that come from your heart that goes to the penis. It opens up, blood flow into the penis. The corpus cavernosum, which is the smooth muscle of the penis, gets engorged. When it gets filled up with blood, the muscle, the corpus cavernosum, compressing against the Buck's fascia, the veins gets compressed. When the veins get compressed, the blood stays in the corpus cavernosum, or the penis, allowing a firm erection. I hope that makes sense. And therefore, when you have venous leakage, the veins, however, fail to be compressed, and therefore the blood flows back out, leading to the loss of erection. The majority of ED is due to venous leak. I would say probably around 70%. And it usually presents as you're able to get an erection, but then you lose the erection when you have the firm erection, or you lose the erection during penetration. The arterial or blood flow restriction that's from the artery is really more in difficulty in getting an erection. Luckily, venous leakage actually can be treated by just lifestyle modification, or even a simple thing such as doing focused shockwave and also platelet-rich plasma using your own stem cell treatment. So having said that, just know that venous leakage can present first, that sometimes when you take ED medication, it actually may not help with the venous leakage as much. And something that you also note too is that when you have venous leakage, it may show up as loss of morning or nighttime erection. The risk factors of venous leakage is from diabetes, from vascular disease, inflammation, neurological disorders, and radiation therapy, and Peyronie's disease. So doing treatment options that I mentioned earlier is penis pump, Kegel exercises, diet, exercise, and also sleep and Mediterranean diet. And make sure that you go see sexual medicine specialist, and also get blood work as well, looking at your blood, your liver, your kidney, your blood sugar, your cholesterol, and your hormone. Do not ignore your ED. It could be a warning sign that you may have vascular disease that could lead to a heart attack or stroke in the future. And what you're listening to now may save your life. And a simple thing such as doing blood work may resolve your ED issues at this point. I hope you find this useful. I would appreciate if you like and subscribe and share this episode that you find useful. And just know that you are the modern man, that you can live more, love more, and be happy. And let's together create a sexual revolution so we can all have sexual independence without medication or surgery. I'll see you in the next episode. Hello there. Want an amazing sex life? This free gift is going to give you more sex by helping you get harder and lasting longer. Let's talk about the most sensitive subject, the effect that aging has on your sex life. If you're over 40, there's about 67% chance that you have to deal with one or more of these issues. You sometimes go soft in the middle of sex. You sometimes have trouble lasting long enough to climax. Your erection just doesn't feel as hard as it used to be, and your penis is not as sensitive as it used to be. You cannot reach orgasm or ejaculate. You sometimes have trouble getting an erection. These things lead to frustration and embarrassment when you cannot please your partner. My name is Dr. Ann Truong, and I've been treating men for issues like this for over 25 years. As a board-certified medical doctor who specializes in men's health, I helped over 7,000 men reverse the effect of ED. As a way to introduce you to the ED treatment that I offer, I want to give you the most incredible free gift ever. But don't let the fact that it's free gift fool you. This powerful gift will help you get harder and stay and last longer, and may just revolutionize your sex life, making sex more exciting, more thrilling, and an amazing experience again. How is that? So here's what you're going to get in this most incredible free gift. Number one, a good morning wood smoothie recipe. This is my specially formulated antioxidant recipe that will help you get harder and stay and stimulating more blood flow. It is formulated to increase your nitrous oxide level, which is one of the biggest keys to making you harder and firmer more often, and will also help you last longer. It is filled with lots of greens that create more nitrous oxide in your blood. This smoothie will give you that morning wood effect and will also make you harder on demand when you need it most. And you'll see the effect in about several weeks. Number two, nitrous oxide testing strip. You will also get 2 of these strips, which you will use along with simple instructions to test your nitrous oxide level in your saliva. Nitrous oxide is a gas in your body and is required for good blood flow to the organ. The strip can determine if your nitrous oxide are deficient, which can help us advise you on the best way to reverse your ED. Even more important, since ED is an early warning sign of problems with circulation and heart health, this can also be a great way to prevent heart-related problems such as strokes and heart attacks. Number three, and the best part of all, a 30-day free trial access to the Modern Man Club. As part of our mission to make men hard again, we launched the Modern Man Club as a way to provide education and support to a community of men who's on the path to reversing their ED, with pre-recorded and live session being offered every week. I will help men regain sexual health through training, support. I will be there all the way with you to hold your hand through, so that way you can overcome ED and have your best sex life. Members rave about this session and the sense of community they gain by being a member of the Modern Man Club. And all you have to do is to say maybe to this offer. And once you say maybe, you will be on your way to a more fulfilling and exciting sex life. So all you have to do is fill down the form below, and then I will see you on the inside. Thanks for listening to the Sexual Health for Men podcast. If you love this episode, then please take a screenshot on your phone and post it on Facebook, Instagram, or wherever you post. And be sure to tag me and let me know why you like this episode and what you like to hear in the future. That will help me know what's great for you, and I would love to give you the most incredible free gift designed to help you improve performance quickly. Go to my website at sexualhealthformenpodcast.com to get the book, The 5 Common Costly Mistakes Men Make When Facing ED. I would appreciate it if you subscribe, leave a review on Apple Podcasts or wherever you listen, and just know that you can have sexual vitality for life. I appreciate you. Until next time.